Hello and welcome to Local Doctors on Call. I'm Alex Redmond. If you live long enough, you will get cataracts. That's the good news. And there is cataract surgery. It's greatly improved. And what was once a risky procedure with a long recovery and less than optimal results is now done routinely as an outpatient procedure that can have you seeing better than in years. And most recently, bladeless laser cataract surgery is being performed by some of the skilled surgeons right here in Sarasota at the Eye Associates. Well, tonight we are joined by Dr. Kathy McCabe, who will answer your questions and tell you about bladeless laser cataract surgery. She's a board-certified ophthalmologist, a cataract and LASIK surgeon, and a high-tech intraocular lens replacement specialist. Welcome back, Dr. McCabe. It's good to see you.
Thanks for having me again. It's good to be here.
Well, this is an exciting topic because we've covered this topic a couple of times, and now you've had the laser for a few months, and we keep getting emails asking about when are we going to talk about this again, especially from people that have not yet seen the show. So how far have we come in cataract surgery? Because it wasn't always this easy.
It's true, and in fact, you know, when cataract surgery was first performed, all we did was take out the cloudy lens as one huge, unit all by itself with a large incision. It needed lots of stitches, and a lot of people remember people having to be in the hospital for a couple of weeks and not move. So fast forward to today, and we now have a 10-minute or less procedure. It's outpatient, you're awake, you're comfortable, you see some sparkling lights, and when you leave, you don't have anything covering your eye and you see better. So that's a huge improvement.
All right, we're going to go ahead and open up those phone lines. The number is 361-4675. We are live tonight. Dr. Kathy McCabe of the Eye Associates would love to answer your questions. 361-4675. And Carol is on the line. Carol, thanks for calling. Go ahead with your question.
I do have a cataract question, but first I would like to ask about a condition I have. It's very painful when I go outdoors. I am blinded by the sun, and I was wondering if there was a name for that situation and a cure for it.
Well, what you have, our technical name for that is actually photophobia. That's what we call the sensitivity to light that you have. And it's not a specific condition, it's more a symptom. It can be caused by lots of things. It can be caused by inflammation in the eye. It can be caused by things that cause glare or halos, like dry eye even, scars in the cornea, or believe it or not, cataracts. Because cataracts scatter the light as it tries to pass through your natural lens that's now become cloudy. And that can cause you to become very sensitive to that bright light as it scatters within the eye. So the first thing we want to do is take a look and see what the cause of your photophobia, that sensitivity to the light, is. And then we could try to determine a strategy to decrease that for you.
All right, and if you would like to reach out to Dr. Kathy McCabe of the Eye Associates, I'm going to go ahead and give you a website. They have a new web address. That is site4life.com. Again, that's site for life, or you can reach them at 866-865-2020. That's 866-865-2020. Easy number to remember. Now,
did Carol have another question about cataracts? I feel bad if we didn't.
Oh yeah, Carol, are you still on the line?
Yes, I am.
Yeah, you had a second question?
Yes, I have cataracts, but I can't get surgery because my body rejects foreign objects. So I didn't realize that you took out my lenses that I was born with and you put in a fake one. So I don't want to go through that and then have it taken out.
Sure, and I'm glad you bring that up, Carol, because there are a lot of patients who worry about that, because when you have a transplant of tissue, which has all of the markers that tell your body that that's not you, it's something else, we do worry about your body rejecting that tissue. And the lens in your eye, which is the cataract, is removed in cataract surgery. If we didn't put a lens in, you would wear very, very thick glasses to make up for the power that was naturally in your own lens. Now, the good news is that the material that the implant is made out of, which is either silicone or acrylic, is absolutely not recognized by your body. It won't be rejected, you won't have an inflammatory response, and it will not need to be taken out. Nobody reacts to that material. So your eye is kind of what we call a privileged site in the body that your body doesn't really recognize or mount an inflammatory reaction as strongly within the eye, and especially doesn't mount one at all to the types of materials that we use. So I don't want you to be afraid to have your cataracts out, because having them out and having an implant could allow you to see a whole lot better. So nothing to worry about there.
All right, that's good news for Carol, definitely.
Yeah.
All right, we'd love to hear from you. The phone lines are once again open. The number here is 361-4675. That's 361-4675. And we are discussing the Bladeless laser cataract surgery, which is absolutely phenomenal. I mean, it sounds like such a great thing. We've come such a long way.
Well, we have, because today the traditional way that we have done surgery is to use a very tiny diamond instrument, a blade really, to make a very small opening in the clear cornea in the front of the eye. It's tiny. It's less than 2 millimeters in size many times. And it's an excellent surgery done, by hand largely, the way that we've always done it. Now, the advancement that we have now with the Bladeless laser cataract surgery is those incisions are now made with a laser that's computer guided, and it's guided by very high definition images of your tissues in your eye. So everybody's cornea is a different thickness. That's that clear window in the front of the eye. Everybody's eye has a different curvature and it has a different size, and we can image those tissues to be very, very precise in the geometry of the incisions and in the length and shape of them. And the laser actually does that in a way that's no touch. The surgeon doesn't have to touch the eye at all, and we're able to achieve that.
I think because we're talking, you're describing what happens, we should go ahead and talk about that, because what can somebody expect if they come in, they have a cataract? People are nervous because many people remember the old way that it was done. How many stages are involved in the operation, and how does it go?
It's funny that you ask that, because I actually walk patients through that on the day of cataract surgery just that way. I say, steps really. So the patient comes in and they'll be greeted by the staff. They have their pupil dilated with drops, just like you do when you go in for an evaluation with your doctor's office. So that's not very difficult to have. And then the first step that we do is we take them into a room where we're able to mark gently on the eye where their astigmatism is. And that gives us a map for the laser so that the laser can then lock onto that and determine where those incisions need to be made. So step one is locating the astigmatism preoperatively. Then they're taken step two into the laser suite, and that's usually about a 3-minute procedure. And they'll see some sparkling lights. They'll have people talking to them. They usually describe it as kind of like a little light show, laser light show that they see inside.
Any pain involved in that?
No pain whatsoever. Very, very comfortable. Most patients are like, wow, I didn't really know anything was going on, just saw some sparkly lights. And I tell them step 2 is done, and then we go into the operating room for step 3, where I use an ultrasound to break up that cataract that's already been softened and remove it from the eye to put the implant in.
All right, let's go ahead and take a little break, and I believe we have someone holding on the line. We'll take your question when we come back, and if you'd like to take the opportunity to call in, the phone number here is 361-4675. That's 361-4675, and we're talking about brand new technology in removing your cataracts with a laser. Please stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alex Redmond, and tonight we are joined by Dr. Kathy McCabe of the Eye Associates, and we are talking about new technology, bladeless laser cataract surgery. So if you would like to call in, the phone number here is 361-4675. That's 361-4675. We are live tonight, and we have Lois on the line. Hello, Lois.
Good evening.
Good evening.
Yes, I had laser surgery for vision, and I'm starting to lose my vision now, and I have cataracts, and I wondered if I would be able to get the bladeless laser cataract surgery, and also if they will be able to implant the lens for that.
And Lois, I have a lot of patients who come in who start to lose some of the vision that they have enjoyed for a long time after they had LASIK or PRK, or one of the laser vision correction procedures. And once you develop a cataract, it starts to change your glasses prescription, or if you've had LASIK, even put you back into glasses. And those are the patients, such as yourself, who are most interested in taking advantage of some of the new technology that we have to help you to be independent of glasses, again, after your cataract surgery. So the good news is you can have bladeless laser cataract surgery. Nothing about your previous treatment makes it so that you cannot. There might be some lens choices that you wouldn't be the best candidate for, but we always have other choices that would work well for you. So again, that's just part of analyzing your tissues, your eye, your geometry, and seeing what would work best with the goals that you hope to achieve. But you can have laser cataract surgery, and you can have an implant, and you can even have one of the most advanced implants. It's just picking the right one for you.
All right, Lois, thank you for your phone call. And if you would like to call in with a question, the number here is 361-4675. That's 361-4675. It's a great opportunity to speak directly to Dr. McCabe without having to make an appointment yet. So why would you elect to perform the bladeless laser cataract surgery over traditional cataract surgery on a patient?
Well, you know, a lot of patients are really looking forward to trying to be more independent of their glasses. And sometimes we can achieve that with a full range of vision with one of our multifocal lenses. If what we're trying to do is minimize any dependence on glasses, the bladeless laser cataract surgery allows us to make all of those incisions so precisely that we can eliminate the astigmatism that a lot of patients have as well, and be very precise on where that implant sits in the eye. Because that's one of the things that determines whether or not you need glasses after your surgery. So anybody that we're trying to help to see more independently of their glasses, using this technology is extremely beneficial. So that's the primary focus of our patient selection. Now, it might be a multifocal lens where they see a full range of vision, or it might be that they're not a good candidate for that. Some patients are not because they have a health problem with their eye, but we can maximize their distance vision. It may not be perfect vision if they have another problem like glaucoma or macular degeneration or something, but we can maximize that vision and minimize their dependence on glasses by being so precise. So almost anybody could benefit, really.
Do you find that when you do just a basic cataract removal, though, with the laser, there's less touch-ups that you have to do?
Exactly, because now we've made the opening that's on the surface of the cataract that helps to locate the implant in the eye, a perfect circle of the perfect size in the perfect location every single time. It's just completely reproducible. It's a computer. It doesn't have all of the weaknesses that we as human beings have. So
now, how long has the procedure been around?
So bladeless laser cataract surgery has been around maybe for 2 years now. The technology came out initially then. It's gone through a lot of improvements even since it originally came out, and now it's really a kind of a finalized sort of product where we can offer it to patients and feel very confident about results.
All right, the phone lines are open. We'd love to hear from you, and the number here is 361-4675. That's 361-4675 with your questions about bladeless laser cataract surgery. Now, when you use the laser, do you still do one eye at a time, or do you do both at the same time?
We do, and that's one of the things that's a little bit different than using lasers for laser vision correction. If we do LASIK or PRK, that kind of correction that we do to help people be glasses free who don't have cataract surgery, those we do both eyes at the same time. For this procedure, it is more like straight cataract surgery, just the normal cataract surgery that we used to do in the past, in the fact that we do one eye at a time. Depending on what your needs are, what your prescription is, you know, what the situation is, we might do those a week apart. We might do both eyes 2 weeks apart. That's kind of the typical range, 1 to 2 weeks, or more if there's more healing that's necessary or patients have other concerns or considerations, which often include family, you know.
After you've had the surgery performed, how long is it before you can go about your normal activities? Go back to work?
The number one question people ask me is,
when can I work out?
That's in your life. But that's probably one of the top ones. And then the other one is golf. When can I play golf? And so I guess in some people's minds that is working out too. But no heavy lifting for a week. And I really don't want patients to put their head completely below their waist for that first week. So I say you can do yoga, but no downward facing dog, that kind of thing. And you can bike, you can run, you can walk, you can do any aerobic exercise, but no heavy lifting of weights for that first week. As far as golf goes, just because I know there are some viewers out there that are probably as enthusiastic as my patients are about that, you can play golf within the first day or two. Just have somebody lift your bag if it's heavy. So.
Do you have to wear an eye protector or anything? Would that be a good idea to wear some kind of glasses?
You know, that's one of those things where patients ask me, when can I play basketball without my, eye protection on? And my real answer is just the same answer as people who smoke and say, when can they smoke again? And that's like never, because really you should have eye protection on when you're doing a lot of these sports, and you shouldn't smoke. So, it's best to wear eye protection when you're doing things where you might be hitting the eye. It is especially important to do those things, to wear eye protection right after surgery. So, I'm more concerned about it after surgery, but really it's always a good idea.
All right, again, the number here is 361-4675. That's 361-4675. Go ahead, pick up the phone and call in. I think that we should also let people know that the week after next, you're going to be having Tony Panico on again, and he is a golfer
He's a pro golfer. So he had clear lens replacement surgery, as I'm sure you remember. We definitely are happy to have helped him with that, because he had a pretty high glasses prescription and knew that it was difficult. As a patient explained to me just the other day, if you're a golfer and you have glasses on and you're trying to putt and you're trying to look down and you're looking through the edge of your lens so many times with your glasses, that's really difficult. And so Tony was having some of those same issues, and he was happy to become free from his glasses by having a clear lens replacement surgery with one of those multifocal lenses. So he's going to come back and tell us again about his experience.
And we actually filmed some of that, and that was pretty incredible when he had the surgery, because I remember thinking that, I'm terrified of surgeries, but when I saw him at the surgery, right afterwards, we were there during it. It took just a few minutes, and then he got up and he just said, "Okay, may I leave now?" And his kids were there, and they saw him. They went running in, and he just got up and out he walked.
Yeah, and his little girls actually watched. They did watch it on the video too, so it's nothing to really worry about too much or anything. So yeah.
All right, again, the number here is 361-4675. That's 361-4675. We are live tonight. We'd love to hear from you. Go ahead and call in. All right, so many people want to know, do cataracts grow back? But we'll do that question in a minute, because I think we have a phone call. We have Bob on the line. Hi, Bob. Welcome to Local Doctors on Call. What would you like to ask the doctor?
Oh, thanks for taking my call. I just wondered if surgery is possible if you have a pterygium, or does it affect anything about the surgery at all?
And so a pterygium is something we see a lot of here in South Florida. That's a growth on the surface of the eye, and sounds like you're very well aware of what that is. You may have that yourself, and that growth covers a portion of the cornea, that clear window in the front of the eye. You can have surgery if you have a pterygium. You can still have cataract surgery. If our goal, though, is to help you to be glasses free after cataract surgery, a pterygium can cause astigmatism, and so we oftentimes want to remove that before your cataract surgery, so we get the best reading on what your astigmatism and your curvature of your cornea will be when you don't have it any longer. So we usually will go ahead and remove that pterygium first, let that heal, and then do your cataract surgery. But I often hear that question too.
Thank you for your phone call, and we're going to go ahead and take a little break. Pick up the phone and dial in during the break, and Dr. Kathy McCabe will answer your question when we come back. The number here is 361-4675. We are discussing bladeless laser cataract surgery. So call in 361-4675. Stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alex Redmond, and tonight we are joined by Dr. Kathy McCabe of the Eye Associates, and we are discussing bladeless laser cataract surgery. How high-tech is that? It's unbelievable. And this is the type of surgery which will have you up and out the first day and no pain.
Yeah, and really no downtime either. So, patients, the day of surgery, I don't want them to drive, because they did have a little bit of medicine by vein so that they're nice and relaxed during surgery. But they probably feel good enough to drive, so we kind of have to remind patients, no, at least today, let somebody else chauffeur you around, and you do need to have a driver to and from our facility that day. But as far as the next day goes, you can really go about your normal activities. You can do your normal activities that day even, just not driving.
Are there any people that are not candidates for the laser surgery?
There are patients who, because of the condition of their eye, may not be able to have the laser for portions of it if your pupil is very, very small and we need to do other things to make the pupil wider during surgery. We wouldn't be able to use a portion of the laser treatment for those patients. Some patients have extensive corneal scarring and the laser cannot treat through that corneal scar. So it's rare, but there are some patients who really just can't take advantage of that.
Now, what are the warning signs that someone may have a cataract?
Well, you know, I just had this conversation with a lady today because the patient was saying, you know what, I just didn't know I had cataracts coming on. I thought I needed a change in my glasses prescription. And that's the most common thing we hear first from the patient is, you know what, I noticed my vision was getting a little fuzzy. I thought all I needed to do is come in and have a new glasses prescription and that would take care of it. And in the early stages of a cataract, that's true, that will take care of it. But as the cataract progresses, even changes in a glasses prescription won't do anything to improve patient's vision. The other thing is a lot of glare and halos at night, and that we do hear a lot as well.
Now, when should somebody first come in and see an ophthalmologist to get a baseline?
You know, anytime you've seen a change in your vision, you should have that checked out because it could be something very serious, something that we need to treat right away. There are lots of eye conditions that patients kind of hope will go away. You know, I started to see really poorly 2 days ago. I didn't come in because I kind of hoped it would go away. Well, that's never a good idea. So if you're noticing either a sudden decline in your vision and then you need to come in right away, or even a gradual decline in your vision, that's not normal. That's not really a part of aging. Everybody who, you know, has a healthy eye and is walking around seeing well should continue to see well unless something changes and there is a problem that's developed in their eye. So if you see a change in your vision, come in.
All right, if you'd like to find out if you are a candidate for bladeless laser cataract surgery, go ahead and pick up the phone, call 361-4675. That's 361-4675. We are live tonight. Now, we talked a little bit about the surgery. You kind of walked us through that. But what about the tests to see if someone's a candidate for it? What should they expect?
So if somebody thinks they might be developing a cataract, what we would do is have you come in for a full eye exam. We would check first to see if there's a need for a change in glasses, and then we always dilate the pupil so we can see where the cataract is. It actually is behind the colored part of your eye, your iris. So we look at the dilated exam, look at the cataract, the lens itself, and look at the health of the retina as well.
All right, we have a phone call. We have Anita on the line. Hello, Anita. Welcome to the show. What would you like to ask Dr. Kathy McCabe of the Eye Associates?
I had a surgery done 2 weeks ago, and I still have like a light film in front of my eye, and I was wondering why is that?
You still have a light, I'm sorry, I missed what you said right after that.
Like film in front of my eye, like a little fogginess.
A little fogginess in front of the eye, okay. And you had cataract surgery a couple of weeks ago, is that correct?
I had 2 weeks ago.
Okay. And so it depends a little bit on what the density of your cataract was to begin with and what the goals of the surgery were. So if the goal was to keep you glasses free, at distance anyway, then we would expect a more quick recovery of your vision. But if you had a standard cataract surgery done the standard way, then it's very likely you have a little bit of glasses prescription that you need to have that's different than the glasses you had before your cataract surgery. So sometimes we have to wait for healing and then give you a new glasses prescription that will sharpen up your vision. So it's hard to say without taking a look, but those are very reasonable options for why you'd still have a little bit of fuzziness there.
And of course, if you would like to reach Dr. Kathy McCabe of the Eye Associates, here is the website and the phone number. You can reach her at site4life.com. That's site4life.com, or call 866-865-2020. What would you like people to know that, for people that are afraid to come in, because there's still that fear of cataract surgery, what would you like to share?
Yeah, and I just want to reassure patients that First, everybody gets cataracts. It's nothing you did wrong with the health of your eye. It's really not so much a disease of the eye as the natural aging process. And so everybody will go through that. And the second thing to know is that the cure for that, the cataract surgery itself, is the most common surgery done in the United States, and it's very painless, quick, and will improve their vision. So don't be afraid. We can help you see better.
And are there things that people can do to improve the health of their eye that could slow down getting a cataract, or wearing sunglasses? Will that help?
Well, we do know that there are things like sun exposure, like cigarette smoking, certain drugs that patients need to take for other reasons, like steroids, that can accelerate cataract formation. So eating a healthy diet, staying generally healthy, wearing sunglass protection, those are things that will help keep your eyes healthy, keep you seeing great for life, and help you slow down progression of any eye disease, including cataracts.
And again, not next week, but the following week, you're going to have Tony Panico on, who is a golfer, talking again about his surgery.
Yeah, he's a lot of fun. I can't wait to have him on.
And then people can call in with that. So don't forget, Dr. Kathy McCabe will be here in 2 weeks from now. We want to thank you for taking time out of your busy schedule to join us on Local Doctors on Call. And remember, it's your health. We'll see you next time.